Okay, let's start the case. Margaret, 32-year-old woman, had some problems. She described herself as sensitive and emotional, and said some problems started before a year ago. During shopping, she felt anxious, nervous, and panicky, but it went away in a few minutes. However, the same thing happened 2 weeks later. Her heart was beating fast and felt going to pass out. So she tried to real effort to go out. Also, sometimes she burst into tears for no reasons. Now she feels embarrassed even when reminding that memory and talk about it. In addition, she told us a most recent examples when it was happened. It was just over a week ago. She feels anxious before went out, and in the shop she began to feel a bit breathless and nauseous. Also, she thought that everybody looking at her and thinking she was stupid, and she thought stupid herself either. After that, she got a pain in chest and thought it was a heart attack. But she remembered something that read before and told herself it was a panic. It helped her for 10 seconds, but panic came again. Surprisingly, however, she went back to shopping and finished it. Also, she felt proud and told herself, just pull yourself together, nobody cares, they're just all too busy getting on with their own stuff. And I think that she has social anxiety and general anxiety disorders. First, social anxiety disorder patients shows avoidance of social situation and feels anxiety about being humiliated or embarrassed socially. Margaret said that she was stupid and thought that other people would say she was stupid. And second, the general anxiety disorder patients feels anxious about a number of activities and marked avoidance of situations in which negative outcomes could occur. Also, marked time and effort preparing for situations that might have a negative outcomes. And then Margaret had already anxious before went out. And I think there are some factors that might have influenced to Margaret. It could be just a personality or a trauma or punctuating parenting or genetic vulnerability or decreased function of JPA, etc. But the most exert factors might be a trauma because I think when the first time that symptom occur, it becomes a trauma. So every time when she goes out, she felt anxious. So how can Margaret overcome that disorders? I think the cognitive approaches are good for her. She already used it and it was effective. So we only need to increase her own belief in ability to cope with the anxiety trigger and make her to challenge the expectations about the negative outcomes. And there are more details can her help her. First, make her challenge and modify negative thoughts. And second, make her increase ability to tolerate uncertainty. Third, make her have a time to worry only during scheduled times. And last, make her focus on the present moment. Uh, mm, okay, thank you.